We're going to do imaging on the nasal bone, and I wanted to show you how to do it with the tabletop technique. And the patient is an ambulatory patient. You can just let them have a seat at the end of the table, use an extremity cassette, and you can just do both laterals with the patient in this sitting position. Now I'm going to have this patient put the right side of her face down onto this cassette. Okay, and what you want to do is check that the head is in a lateral position, as if you're doing a lateral skull or lateral facial bones. You want to check and make sure that this mid-sagittal line is going horizontal. Okay, you want to check your interpupillary line, that it is going vertical. So once you have double checked and make sure that both of those have met your criteria, then you can center right over the nasal area. Now here's our nasion right here, and we're going to come down about 1/2 inch. And then you can collimate tight. And you just collimate to the nose, because we want to have it from the nasion all the way down to the very bottom part where you have the process, the acanthyon process. So because the right side of her head is touching, I'm going to put a right marker there. Alright, so this would be our first nasal bone, and then you would do just the opposite for the left side. So I'm going to let her lift up her head. I'm going to adjust my cassette, and I'm going to put my image on the other side. So put the left side of your face down, and I'm going to get it centered to the other half. So I'm going to scoot you forward a bit. Okay, position the head in a lateral position and double check. Make sure that you do have your mid-sagittal line going horizontal and the interpupillary line going perpendicular. Then again, you can center right over that 1/2 inch below the nasion, and then collimate down so that you get the entire nose area. Now, because the left side of her face is down, we're going to put our left marker there. Also keep in mind, some radiologists don't like for you to do 2-on-1 on a cassette. If this is the case, then you're just going to do one lateral and then do the next lateral on another IR.